Start now. We affirm the resolution that this House regrets the rise of telehealth. Let us understand what this res means. So first of all, we see that because of the word regrets, this resolution is a value round because of the fact that we are trying to understand the utility and the morality of things like telehealth. We say in order to understand the benefits of, sorry?
POI?
Oh, I'll take it at the end. Sorry. So, in order to understand the better benefits of telehealth, we prefer.
I'm sorry, but is it this House celebrates the rise of telehealth?
Oh, I'm so sorry. Why did I write the regrets? My bad. This House celebrates the rise of telehealth. We affirm this is a value round. We prefer that was my bad. We prefer the value criterion of utilitarianism. And specifically, we're going to be making the argument that the most important thing you should be considering in this round is accessibility, as that is generally the best way to understand the topic of health. And it is an incredibly important issue, as if people are not even able to access health, then it doesn't even matter if the health is good or healthcare quality is good or bad. So accessibility should be the biggest thing you should be orienting your ballot towards. Let us understand some definitions. So first of all, we would say that telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. We see that telehealth was used as a means to diagnose and treat patients during the pandemic and is still used today. Sorry about that mishap at the beginning. It is celebrate. All right. Our first advantage is that of accessibility. Claim the rise of telehealth has been super useful in being able to combat issues of inaccessibility in the healthcare industry. Let's look at a couple of examples of this. So first of all, we look at rural health. Access to physical healthcare has been really, really hard for rural areas. Historically, we see, for example, rural Americans live an average of 10.5 miles from the nearest hospital, compared with half of that in suburban areas. This can amount to 30 to 40-minute drives or even longer, especially for rural Americans, which is super bad in the case of things like health emergencies. The second argument we would talk about is movement ailments. For example, elderly patients or other patients who have disabilities when it comes to moving can be diagnosed or treated digitally, so they don't have to travel to long in-person appointments, even when they have conditions that make it hard for them to move. This shows you how telehealth allows them to take appointments from the comfort of their own home, which is incredibly important when considering accessibility. Moreover, we see that there are also less locations for treatment, especially in impoverished areas. A lot of analysis, especially from Journal Sentinels, show that the largest U.S. metropolitan areas showed that people in poor neighborhoods are less healthy than their more affluent neighbors, but more likely to live in areas with physician shortages and closed hospitals. Now, the fourth argument here is that telehealth is a very important thing in terms of solving for this. Now, I want to make a very clean distinction here because this is going to be a pretty big point of stasis in this debate. Telehealth is primarily outpatient care, not inpatient care. So basically, there are two types of care, right? There's inpatient care, which is generally like hospitals, and it's happening in, and like the patient is generally staying within the facilities. Those are very, very severe issues, and those are issues generally where you would always be inside the hospital. Telehealth is not used for that. Telehealth is primarily outpatient care, which is meant that it's mainly meant to combat issues like, for example, if you go to an appointment or you want to refill a prescription, that is outpatient care because it doesn't require you staying in the hospital. It just requires you to go for an appointment. We say that these issues are generally more they're not as severe as inpatient issues. And this is what most people use telehealth for. They use it for things like prescription refills, whereas prescribing full new treatments or diagnosing complicated diseases is a much different scenario. So secondarily, this means that people will be able to deal with massive amounts of sicknesses specifically because they don't need to, they'll be able to have more access to healthcare. That's holistically good, obviously, because more access to healthcare means that they'll be able to deal with health issues. For example, a recent study looked at the use of telestroke services, which used video conferencing to connect specialists in stroke centers to healthcare providers in smaller hospitals with fewer resources. The study found that these services had increased significantly, especially during the 2008 and 2015 time period, especially in rural areas. Telestroke services help increase the use of life-saving treatments, such as ensuring that stroke patients get a clot-busting drug called Altos within the national standards of 60 minutes. Moreover, we see that also in terms of mental health services, which are incredibly important in the status quo. Telehealth is much better because it proves that you're able to get access to that almost immediately. The ultimate impact of this is accessibility, which is very key in healthcare in order to save lives. Judge, people in poverty on average live much shorter lives than their counterparts, making it especially especially hard because they can't access important healthcare that literally saves them. This problem requires fixing, and only telehealth can do that in the status quo. Let us look at our second advantage, which is that of COVID-19. We saw that during COVID-19, when too much movement and contact with people was super risky and people had to stay at home, telehealth allowed people to access healthcare, in fact, showing that it rose by almost 63-fold during the pandemic. That shows you how much impact telehealth had on people's lives. Moreover, we saw that this prevents disease because people aren't as in contact with each other. The CDC estimates 2 million people are infected annually purely by hospital-acquired infections, which means going to a hospital itself makes you very, very likely to acquire an infection. Meanwhile, telehealth was able to reduce unnecessary exposure to COVID-19 and other types of viruses, help mitigate the spread, and reduce surges in hospitals and clinics. In the end, this means that there's less death and less disease overall, which means that functionally we are able to help the spread of viruses that can be super detrimental to people's health. The final advantage we will be talking about is that of efficiency. Now, one of the biggest advantages that is very important to consider when it comes to telehealth is the idea of quick prescriptions, because prescription generally doesn't require an in-person appointment, but most of the time without telehealth, that's what people do. They just end up going to they end up going to clinics and trying to get the prescription through an in-person appointment. But what we see here also is that telehealth was able to cut down on the amount of time that is used to get prescriptions or that is used to diagnose cases. For example, consumers generally absent telehealth typically travel for around 30 minutes purely for veterinary services and face around 5 minutes for wait time, as well as 31 minutes for legal services, including 27 minutes of healthcare services, including 27 minutes of travel time and 4 minutes of wait time. Telehealth was able to cut down a lot of these issues, which shows that we had better efficiency and people were able to be diagnosed faster, which means that made it easier to get prescriptions. So proud to affirm.
All right, just before I start my time, hi everyone, I'm Maya Young. I'll be giving the first speech for the negation, in which I will be going over 3 contentions for the negation and then answering the aff case in the order it was read. With that, I have 8 minutes. Is anyone ready? Okay, just setting up my timer. I have 8 minutes and my time starts now. Hello, judges. Today, I'm proud to negate the resolution that this House celebrates the rise of telehealth. Let's get straight into our first disadvantage, which is about accessibility. We tell you that prior to telehealth, rural areas of the United States were actually getting service. Like there was rural hospitals exist. There is still existing services. They actually had greater numbers of hospitals in rural areas pre-telehealth. However, what we see is that with the rise of telehealth, rural individuals actually have much less access to healthcare. In fact, in 2018, the Federal Communications Commission estimated that 1/4 of rural Americans and 1/3 of Americans living on tribal lands did not have access to broadband internet, which means they don't have access to telehealth. We see there's a similar situation for the elderly, where half of United States seniors do not have internet access. And this also just logically makes sense that people in rural areas and people who are on the older side have both less incentive and also less material means to acquire the technology required to access telehealth, which means telehealth isn't really helping these people. And this means that healthcare is becoming increasingly inaccessible for critical groups, because the appeal of telehealth means that there's less incentive to invest in and continue funding and establishing programs that do provide in-person, high-quality healthcare to rural individuals. So we see that with the rise of telehealth, there is a decline in in-person health, and specifically a decline in in-person healthcare for most marginalized individuals, which has bad impacts in terms of providing quality healthcare and quality of life. Our second contention is going to be about industry barriers. First, we see that telehealth is super expensive. It requires things like expensive software, hardware, extensive training, hiring additional IT staff, et cetera, et cetera. It means that hospitals and just healthcare providers in general are paying for a lot of the burden in terms of adapting all this technology. It's also really hard to integrate into existing healthcare systems. We see that most telehealth programs cannot be integrated into existing electronic health records that current hospitals have right now. So what this means is that current healthcare programs and service providers who are already really seeing high rates of physician and nurse burnout are going to be forced to handle the additional burden of adapting to a completely new form of healthcare and figuring out a way to integrate it into their systems. In fact, 64% of physicians say that telehealth is less convenient for them to use. So even if it is easier for individual patients to access, the physicians then can't actually provide the quality healthcare that patients want. Thirdly, we also see that clinicians aren't reimbursed by health insurance for telehealth, which means that telehealth isn't actually an affordable form of healthcare. The National Telehealth Policy Resource Center reports that in 2018, only 9 states reimbursed the most basic form of telehealth: live video, store and forward, and remote patient monitoring, which means that because people aren't getting paid for the services they're providing, this is really a not profitable way of operating and is ultimately going to lead to more harms to the funding for hospitals and for healthcare, which impacts out to quality of healthcare. Now let's talk about our third contention, which is about cybersecurity. We see that telehealth poses an increasing risk to cybersecurity because as resources are transitioning online, there's a significant risk of information being compromised. We see that healthcare systems right now simply don't have the infrastructure to protect patient information from cybersecurity attacks. We see that 75% of health practitioners said their organizations are vulnerable to a cloud compromise. And we see that this rise in hacking is directly linked to telehealth because as practicing transitioned online during especially COVID with the rise of telehealth, there was an exponential increase in cyber breaches of medical institutions, which also just logically makes sense because the more you use technology and digital websites, the more risk you're going to face in terms of hacking, especially because they haven't adapted to the infrastructure. And due to this, we're going to see a significant risk of patient data leaks and messed up exams proceedings. We see that hacking leads to increased security compromises that can impact patient data and result in blocks for just accessing the system in general. This can also hurt patient health. In fact, security breaches resulted in poor patient outcomes for 57% of healthcare providers. We also see there's the issue of ransomware attacks. For example, UCSF ended up paying over 1 million hackers to return stolen information from their healthcare system, which delayed proceedings and caused major costs to the company. We also see that cybersecurity is just really expensive to deal with because building the infrastructure to combat cybersecurity ventures is very costly. This imposes a new burden for hospitals, especially rural hospitals that are already struggling with funding. And we see that cybersecurity is an extremely high magnitude impact because a single breach in a healthcare system could lead to the shutdown of a practice's whole network for days, leading to massive business interruption, massive privacy issues, delays in care, and even potential lawsuits, which also have impacts on just the quality of care that can be provided in terms of health and accessibility. Now let's talk about the affirmative case. I like to start by addressing their weighing mechanism where they talk about, net benefits through the frame of accessibility. We would contest and we think it should just be net benefits through net benefits because accessibility isn't the only thing that impacts people. Just because you can access healthcare doesn't mean you're accessing good healthcare. And we also want to talk about the quality of healthcare that people are accessing. So essentially the impacts in this round should focus on not just access, but just any impacts to someone in terms of net benefits. Let's move on to the actual contentions, starting with the first contention of accessibility. Basically, the AF tells you that telehealth is accessible, and that's good. And we have a couple of responses here. Firstly, you can turn this argument because it actually decreases access to in-person healthcare. Look to how during COVID, when everything went virtual, rural hospitals faced record high numbers of closures because simply telehealth is not profitable because they didn't have the funds and because more people were investing in telehealth instead of in these important hospitals. But we see that this having hospital closures is more important than accessible technology because hospitals simply provide more services and provide some services that telehealth cannot provide. For example, surgeries, medical scans, and much more. But secondly, we see that even if there is more convenient forms of healthcare like telehealth, this doesn't actually solve because the people who need affordable healthcare are often the least literate in technology use. They talk about seniors, but look to how 50% of seniors don't have technology. They can't access the telehealth, which means the people that the AF is trying to help aren't really being helped by telehealth. And thirdly, again, even if people can access healthcare, the quality of that healthcare is worse. Again, one, just because it's so expensive for physicians to deal with, but also secondly, because telehealth simply just has a higher risk for inaccurate information due to things like lag and video quality and just technical difficulties. And for example, look to how a patient died of a deep vein thrombosis because their physician was unable to diagnose it during a telemedicine appointment. And we see that this has two implications. One, this means that more patients are put at risk, and two, that more physicians are put at risk of being sued for misdiagnosing something that they really couldn't control because the technology interfered with their ability. And just quickly they talk about things like stroke services and mental health services. We just like to point out that there are emergency services. There's 911, there's 211 for mental health. There are other ways for people to access care outside of telehealth. Now let's talk about the second contention, which is about, infection rates and how telehealth prevents like exposure to things like COVID. But as my opponents say themselves, there's a difference between outpatient and inpatient care. And we tell you that inpatient care, which is not as relevant to telehealth, is the biggest cause for cross-contamination. So telehealth doesn't really reduce the risk of infection. And on the contention about, the efficiency of healthcare and like talking about specifically prescriptions, we would tell you that having digital prescriptions is probably a bad idea, because having in-person checkups is really key to doctors being able to check up on people and look for small signs that prescriptions aren't working or that they're even making things worse. Because if a doctor misses something, which is incredibly likely through telehealth, that can have drastic consequences for someone's life, which means, and also people still have to drive to the pharmacist. There's still travel issues, which means that accessibility really isn't solved by telehealth or the time frame issue. So for all these reasons, I strongly urge a vote for the negation.
Okay, hello. I'm the second speaker for the affirmation. I'll first be going over their responses to I'll first be going to their responses, and then I'll be going back over to my case if I have time. Okay, and my time starts. Yeah. Okay, so Judge, the first point they make here is that there's a greater number of hospitals with there's less hospitals with the introduction of telehealth, but the empirical studies flow in our favor. Also, look at it logically. A lot of people in rural areas don't even have healthcare. So this means that telehealth at least provides some level of healthcare. Also, our telestroke evidence literally disproves this. The fact that like rural areas don't have access to hospitals. There's a great number of hospitals without telehealth. So our telestroke evidence literally disproves this, that rural people in rural areas are able to get access to treatment. So we can say that it was able to help people actually get care for stroke services, as we talked about telestroke. Okay. So they mentioned people in rural areas and elderly people don't have access to broadband internet, but this argument is being turned in the status quo because a lot of plans in the Biden administration are trying to implement nationwide broadband, especially in rural areas. So just like telehealth is like relatively new. So over time, as technology improves, as people are able to get more access to broadband internet, this is something that solves for as more and more people get internet access and broadband internet access. They mentioned how telehealth is super expensive. It isn't. Physicians literally use computers even absent to telehealth. So when people are making prescriptions, most physicians need technologies in order to be able to combat health issues inevitably. So a lot of the arguments are framed with this thing saying like, telehealth is like the only technology used in hospitals. No, so telehealth is just an extension of like the technology that hospitals already use. And it's just used, it's mainly focused on telecommunications. So the healthcare industry is literally one of the richest industries in the US. So physicians literally get paid such high salaries, and I think pharmacies have historically been able to provide for incredibly expensive materials. So even if you were to argue that new materials are required for telehealth, this doesn't matter due to it being. So they will be able to provide anyways if you need these new technologies. But once again, it's incredibly accessible, and the technologies are already there to begin with. 64% so they mentioned that 64% of physicians say it is less convenient to use. Convenience doesn't matter if people aren't even able to get to access to healthcare in the first place. So 40% of patients surveyed literally love telehealth. So this argument is much less compared to our argument. Also, like 9 out of 10 people who use telehealth said they would use it again. And so so even if you don't love it or anything, like the convenience doesn't matter because it's just a useful whatever. They mentioned that in 2018, only 9 states were reimbursed for the basic form of telehealth. So telehealth was there was less telehealth introduction back then, and this was pre-COVID. As we mentioned before, telehealth increased 63-fold since then. So telehealth is much bigger now. So it's way easier to get reimbursed, and it's reimbursed now these days, especially during COVID when it was so frequent and used the most and used They mentioned that 75% of health practitioners can have cloud compromises. So this entire data set is all non-unique because technology was used in hospital systems before telehealth. I briefly mentioned this before, but okay. But for example, HIPAA, which is a general statute used to protect patient info, was violated a lot, even despite hospitals being in person. This is all because all info in healthcare is inevitably stored in online databases, and so none of their evidence is specific to telehealth. So like they mentioned, like a ransomware attack. This is literally just like a hospital database, and it's not related to telehealth itself because telehealth is literally just telecommunications, and it's just like communicating like how we're communicating right now. It's not like the storage of like patient information because that's completely non-unique because it already existed before telehealth. So all the arguments about hacking and hurting patient health, it's completely non-unique because it existed before telehealth and it's not related to telehealth. We agree to the net benefits that you mentioned. We're just viewing our case through an accessibility lens because that was how we were framing our arguments. So you should view our arguments through accessibility first and foremost. Going over to our case, they mentioned that rural health actually decreases because there's less access to in-person healthcare. And that like rural hospitals faced record high closures. So this isn't due to telehealth entirely. It's just because of COVID-19, like literally everything shut down and many businesses were lost. So like the fact that hospitals shut down isn't due to telehealth at all. It's just due to COVID-19. So in fact, we are actually providing more healthcare and more healthcare that the rural people wouldn't get otherwise because they are able to use telehealth instead. So they also mentioned physical hospitals have things that telehealth can't do. This is solved because people will go to hospitals if they truly need it. Telehealth isn't like competing with hospitals, it's used in tandem. So telehealth isn't the only way to get healthcare. Yeah, so they mentioned that someone died due to a digital appointment misdiagnosing. This is one cherry-picked example, and we can say that multiple people have benefited from telestroke services. So if you're really you can't really weigh one person misdiagnosing compared to all the lives saved due to like COVID telehealth and like telestroke services that we mentioned before. Also, if you're going to make the argument of misdiagnosis, it's highly unlikely for a few reasons because as we mentioned before, a lot of people who use telehealth services use it just for things like prescription refills versus prescribing whole new treatments and diagnosing complicated diseases. So this means that the negation argument doesn't work here because the original place that they get a prescription from is in person. So the misdiagnosis isn't at fault of telehealth. There's also a difference between urgent inpatient and less urgent outpatient care. So we mentioned like the difference between inpatient and outpatient care. So telehealth is mostly solving for outpatient and it's not used for like inpatient and like important like procedures and whatnot, because that's what in-person hospitals are for. Even in in-person care, there's still things like technology failure. Like as we mentioned before, technology still exists without telehealth. So like technology failure, a study found that there are estimated 12 million misdiagnoses even in inpatient care. So like misdiagnosis is in and of itself non-unique. And the status quo is in the status quo, we are reducing misdiagnosis risk because for example, there's currently already more education being produced and guidelines issued by state and federal governments and funding to further its development. So I believe they mentioned like physicians and people not being able to like know how to access and use telehealth. But they're funding and the National Institute of Health recently announced that it will award 23 million in grants to try and like solve this issue of like, so like they have the money obviously, like as we mentioned before, to like try and further its telehealth development. So like yeah. So yeah, obviously the argument that it's like too expensive and that like it's inaccessible for like physicians itself to be used is false. They mentioned that emergency services can still be accessed other than telehealth, like they mentioned 911, for example, but no, you don't get access to professionals. Like if someone is dealing with mental health issues, being able to talk to a psychiatrist that knows them much better is much more important. So like 911 services and other services like that is like completely incomparable to like telehealth and for its like mental health benefits and such that we talked about. Like a lot of the use cases aren't really related to like what 911 and like other emergency services are designed for. They mentioned like driving for prescriptions, so it doesn't matter. But like the process of like having an appointment to try and get a prescription refill is in and of itself useful for telehealth, because then you don't have to go to an in-person appointment and like ask for like a prescription refill. So that's like an entirely different argument. Okay, yeah. So I'm out of time. For these reasons, vote affirmation.
Okay. Hi, my name is Kira, and I'll be the second speaker for the negative. I have 8 minutes. I'll first be going over the negations case in order, and then I'll move on to the affirmative points. Okay. Is anybody not ready? My time will begin now. Let's start off on our first contention, which is that of accessibility. The overview here is simply that access is not guaranteed for the people that need it. As hospitals switch over from mainly in-person services to online, it actually ends up cutting off access from many groups, particularly the ones my opponents isolate as critical groups who need access to telehealth. We tell you in the status quo, rural areas and elderly people, who are the two main populations who need access in the status quo to medicine overall, are the ones who are going to be most impacted by the lack of things such as technology or technological literacy, because they simply do not have that experience, or they do not have access to that technology. Due to that, we see that these populations are going to be the one hardest hit when we see that we switch over to telehealth entirely, when we see that we are essentially forcing people who don't have reliable internet access to transition to a model of healthcare that is based online. Now, our opponent's only main response to this is that the status quo is solving the problems because Biden is implementing broadband plans. However, this resolution fundamentally comes down to whether the US is celebrating telehealth in its state right now. If it's not working right now, our opponents are celebrating too soon. We'd argue that clearly telehealth in its current form is insufficient to account for the problems in the healthcare system as it is right now, which is why we see that hospitals are failing at increasing rates due to the implementation of telehealth services and due to the requirement and necessity for telehealth services, as my opponents apparently state. We see that having in-person services are much more critical to ensuring access for people, particularly in rural areas, and people such as elderly populations who maybe cannot understand information transmitted via technology, which is why we see that this is especially important in order to ensure accessibility to healthcare. That let's move on to our second contention, which is that about industry barriers. The overview here is that there are simply several big barriers to the integration of telehealth into healthcare systems that makes it not only infeasible, but also expensive and unnecessary or good for the implementation of telehealth to happen. We isolate three big ones. First is that of infrastructure. Simply, telehealth implementation is very expensive. It requires expensive software, hardware, training, and hiring additional staff, for example. Now, my opponent's big response here is that people can afford this, but it is not the physicians who are affording this. Sure, physicians can be well paid, but again, hospitals are the ones who are having to afford pulling in people to essentially develop these telehealth systems. And we tell you that hospitals are not rich. Just extend how the rural hospital closure rate is extremely high right now. That indicates that these hospitals are running out of money and going bankrupt to the point where they cannot afford services anymore. These people are not rich, and forcing additional costs on them is only going to exacerbate the problem. But the second thing is that of interoperability, because while my opponents do state that, yes, there are online systems that exist, for example, online databases to store patient information already, the fundamental problem is that these telehealth systems have to be integrated into these already existing databases. And that causes a significant amount of burden because it is very, very hard to integrate into existing systems because most telehealth programs are independently developed. That means that on net, we see that the integration increases costs for physicians and actually makes the system a lot harder to implement overall for physicians, for example. But the second big implication of the interoperability or the lack of integration means that it exposes the system to significantly more cybersecurity vulnerabilities, which I'll get into on our third contention. But the third big problem in telehealth healthcare systems right now is fundamentally that they aren't being reimbursed. Now, my opponents attempt to bring up that telehealth is increasing, that because of this, because it's on the rise, somehow it's going to solve. However, this simply is not true. It does not matter whether telehealth is on the rise if the government is not paying hospitals back to implement telehealth. The way that insurance works, particularly for rural hospitals where the people there are mainly dependent on things such as government issued insurance, such as Medicaid, in order to get healthcare, is that essentially the person will go to the telehealth appointment and then the government will have to reimburse the hospital for the time spent there. However, the government is currently not reimbursing people for telehealth visits for a significant number of people in the vast majority of states, which is why we see that this is a very big problem. It means that people can no longer afford telehealth or cannot even afford to get onto this. And it also means that hospitals are not being reimbursed, because even if the people end up going to these appointments, the government is not paying them back the adequate amount of money in order to afford the costs of their time and labor. Due to that, we see that because of this, the cost for rural hospitals exponentially increase and closures increase, which is why that's happening in the status quo. On to our third contention about cybersecurity. The overview here is simply that the collapse of cybersecurity with the introduction of telehealth causes significant issues for access to healthcare and the quality of healthcare, which is uniquely isolated to telehealth. You can extend their definition of telehealth here. They directly told you that it's the transmission of information via electronic tech or the distribution of health services via electronic tech. Obviously, the implementation of widespread electronic databases would probably be an instantiation of this. But if you don't buy that, we'd argue that you can isolate this specifically because of the rise in hacking as everything transitioned online during the COVID-19 pandemic. This was specifically isolated to the COVID-19 pandemic when essentially when telehealth increased, we saw that hacking and cybersecurity dramatically worsened simply because we see that all of these systems are transitioning online, and a lot of this interoperability problems, a lot of the integration problems left a significant amount of vulnerabilities in the system because simply enough, the people could not,
Sorry, just real quick, could you re-explain the interoperability? I just want to make sure I'm getting this correct.
Yes. So a lot of the telehealth services are distinct from the existing online databases, right? So in order to implement, for example, video conferencing services into existing online patient databases in order to sync them up, you essentially have to align the system, which is both very difficult because of ingrained structures of the systems are very distinct. But second of all, it's very dangerous because now this linking, this connection exposes a significant new cybersecurity vulnerability for these companies or for these healthcare providers. Due to that, we see that there's a significant increase in things such as ransomware. Now, this is devastating for the healthcare system because a ransomware attack essentially seizes all of their information. A hospital cannot function absent its information or databases. When that happens, you shut down accessibility for everyone. If you have to go to the hospital because you have a heart attack, you are turned away. That is a very, very big problem that outweighs anything else. That let's go over the affirmative case. On their contention about accessibility, the overview here is simply that the accessibility of in-person care is significantly more important than that of outpatient care, because driving 30 minutes to go to an appointment to fulfill a prescription is not that big of a burden, considering that you're probably already driving 30 minutes to see the pharmacist that probably is very closely linked to the hospital right over there, which means that you're already doing that in either world. Instead, what happens when you implement telehealth is that you decrease access to in-person resources, because not only do you increase rural hospital closures, but second of all, you raise the expenses for these hospitals significantly, meaning they have to cut down on in-person services. Now, this is a whole lot worse because in-person services cannot be replaced by online services, which ultimately means that you degrade the quality of health for everyone. Now, the main response is here that it's not telehealth's fault, it's just COVID shutting down everything. That's not true. While COVID did somewhat impact rural hospitals, the big problem was that they had to shift everything to telehealth. And because of that, we saw that the rates in hospital closures increased exponentially. And as that happened, that's continued beyond this. We tell that it's specifically uniquely linked to this, to the rise in telehealth, that hospital quality has gone worse. On their issues about time frame, we tell you that time frame again is bad. You need to be able to check in on people. And on their issues on infection, they've essentially dropped this point and conceded that in-person services or inpatient services that telehealth doesn't affect are the main issues regarding infection in hospitals. For all of those reasons, I strongly urge a negation vote.
All right. Hi, everyone. My name's Maya. I'll be giving the final speech for the negation, just an off-time roadmap. I'll be kind of talking about voter issues. So I would suggest if you're taking notes or flowing, I'd flow this on a new sheet, but I will definitely be sure to talk about be specific about which arguments I'm addressing as I go. With that, I have 4 minutes. Is anyone not ready? Okay. My time starts now. Judges, I think there are two questions to resolve in this debate. One is whether telehealth improves access to healthcare and whether it improves quality to healthcare. So let's first talk about the issue of access. We tell you that access under telehealth is not guaranteed for two key reasons. First is that there are many populations that don't have internet. Again, we tell you that I think it's 2/3 of rural populations don't have internet, that half of United States seniors don't have internet, and that because of this, they're not able to access important healthcare. The very populations that the AF was trying to help through telehealth are not being helped because they can't access telehealth. And it's not just the patients, it's also the hospitals, because the NEG comes up here and tells you that the hospitals simply do not have the infrastructure to handle telehealth. They don't have the existing staffing, they don't have the existing training, they don't have the existing software in order to implement telehealth. They don't have that interoperability right now. The AF may try to come up here and say, oh, well, we have grants going into it right now that it's going to solve. But we tell you that this doesn't mean that we should be celebrating the rise of telehealth for two reasons. One, as my partner tells you, we're talking about telehealth right now, how telehealth has risen and whether we should celebrate that. But secondly, that this funding for internet is coming at the cost of in-person care. Because what this means is as people are transitioning to telehealth, as there's more incentive for telehealth, people are putting less money into keeping hospitals open. Rural hospitals are closing because telehealth is on the rise. But we tell you that this is uniquely bad because hospitals provide care that telehealth cannot. The affirmation may try to say, oh, physicians already have computers. But again, judges, having a computer is not the same as having the software, the cybersecurity, and the IT staff to deal with the unique challenges of telehealth. Otherwise, we wouldn't see so many hospitals struggling to implement telehealth right now. And what this means is that ultimately, the AF does not actually help the people who need accessible healthcare the most, but in the end, actually hurt access to healthcare overall. And just quickly on the issue again of efficiency in accessing prescriptions, extend my partner's argument that the burden as driving is not unique. You're already going to be driving to fill your prescription, so just driving a little bit longer to have an appointment is not as significant, especially given the harms of telehealth care. Now, and even if you buy that telehealth does increase access to healthcare, this is still not a reason to vote affirmation because the increased digital access only has led to a sharp decline in the quality of healthcare, and for a couple of reasons. One is that is just how it is because telehealth simply is not as good as in-person healthcare. There's things like technical difficulties, there's the quality of the video, and this poses a lot of huge risks. One is the issue of, again, underdiagnosis, because when people aren't coming in person to see their doctors, that makes it a lot harder for these doctors to spot little signs like swelling or bruising that could be a sign of a bigger issue, which means that there's going to be a lot of misdiagnoses that leads to more litigation and also just more death because people aren't getting the diagnoses that they need. We tell you, secondly, that another reason why quality would go down is because telehealth is difficult to use, because 64% of physicians don't like using telehealth care. They think it's less convenient because there's a lot of technology that goes into it, a lot of and it's just more difficult to use, and that quality is going to go down. We also tell you that a third and really important issue on telehealth is the issue of cybersecurity, because again, when you transition to more telehealth, when you use more than just your computers for a database, but when you use it for video appointments, when you don't have the existing infrastructure to adapt for this sharp rise in cyber infrastructure, this means there's a huge risk for cybersecurity breaches. And as I tell you out of my very first speech, this has a huge high magnitude impact because again, just one breach in the healthcare system could crash the entire system, could crash everyone's healthcare. And this has huge impacts. So on the impact level, when we're talking about weighing the affirmation versus the negation impacts, you're going to see that we're going to be outweighing on magnitude because again, if one thing gets shut down, everything gets shut down. Cybersecurity outweighs on magnitude. And when they talk about the issue, the affirmation may try to come up here and tell you, access is a prerequisite to quality of healthcare. But again, we've disproven this in two ways. One is that telehealth doesn't help access, and two, that just because you have access doesn't mean you're actually getting the healthcare you need. So for all these reasons, I strongly urge a vote for the negation.
The order is, okay. It'll be a quick overview on the top and then just going down the negative case, then the arguments about the affirmative. Hopefully that makes sense. Cool. If everybody's ready, my time will begin now. Let's take take a massive overview of this round. The problem with the negation is that they go for way too many non-unique, inapplicable arguments that aren't contextualized to telehealth. Look how many times they tell you telehealth is the cause of this, telehealth is the cause of that, but how many times have they given you specific evidence that telehealth was mainly the reason? Every single one of their contentions, I'll read all of them out to you, all rely on things that have happened much before telehealth even rose. Let's start with their first disadvantage. They tell you that we tell you that people aren't even able to access healthcare quickly in the first place. So let's talk about the rural populations arguments. They're painting a world before telehealth like this jolly world where every person in rural healthcare is able to get all the help they need and they're perfectly healthy. This is not the case. We tell you so many pieces of evidence about how rural people literally live 10 miles away from the nearest hospital. I don't know where they're getting their logic from, because if this is true, then any argument about how, it's more inconvenient in terms of technology or it's harder to use technology don't even matter, because it's a question of whether you can even get healthcare in time versus not getting healthcare at all. That's the entire reason why our argument flows through. Now let's talk about this broadband argument, because this is a really, really important argument that I don't think they've done nearly enough work on. They just say that we're celebrating too soon because Biden plans haven't been passed yet. But Judge, this misses the point of the argument. This is just semantics saying that, okay, we shouldn't be celebrating it right now, but who cares? That the point is that there is potential for it. The point is that as long as there's a risk that this can be used for really, really good things, then you should be celebrating it. You're not going to immediately reject everything that isn't automatically solving. If you did that, policies would never be passed. But we tell you that right now, because there are plans that have been implementing massive broadband usage and helping educate people about technology, then that is the entire reason why all of their arguments fall flat on their face, because they literally don't contextualize this to telehealth. Let's go to their second disadvantage. Again, this is probably the most non-unique argument I've heard in this entire round, because they spent a lot of time explaining how expensive technology is. But let's look back at the fact that all of their evidence isn't contextualized. Literally look at the fact that so many databases are what hospitals just generally use. Their argument on interoperability is severely misunderstood, because the argument about interoperability is just about sharing data across bases. But as my partner tell you, this has been happening from even before telehealth. For example, if you move from one healthcare system to another healthcare system, boom, that also involves interoperability. The entire argument is just super non-unique, because inevitably you are always going to run into issues regarding how to be able to regarding how to share data. This is a non-unique argument, because look at telehealth. Our definition is telecommunications. Where in telecommunications doesn't mean that everything is now going to become a database. No, it just means that you're going to be calling instead of actually having to use like instead of having to actually use in-person talking. Even in in-person appointments, you can see on your doctor's computer that they have all of their information about you listed in a database. So all these arguments about how people will hack, this is the third disadvantage, isn't it? Okay, whatever. All the arguments about like how people will be hacked literally don't matter, because their third disadvantage literally is non-unique. People used to violate HIPAA violations way before the telehealth even rose, which is probably a reason as to why you don't get access to this. Let's go to the second disadvantage now. They talk about expensive tech, but again, they just keep talking about how hospitals won't be able to afford this. First of all, hospitals 100% will be able to afford this. Hospitals charge so much for healthcare, which is the biggest reason why the costs of healthcare are rising so much. This isn't just unique to physicians. This is unique to anybody in the healthcare industry. You inevitably pay a lot of price for healthcare, and hospitals make that money. But secondarily, even if you don't buy that, look back at our distinction between inpatient and outpatient systems. Hospitals aren't the ones even using telehealth for purposes in the status quo. It's mostly physicians that use it in the first place, because that's what outpatient care is. That's how telehealth is used, which means this entire argument is practically non-unique. Let's go to our case. They completely dropped our argument about everything about how good telehealth was for mental health during COVID services, during COVID services, as well as the fact that it has been super good for telestroke services. They give you one response saying that this can be accessed online, but look at my partner's refutation. It's very smart. Basically, what he said was that even if it's true that you don't get access to professionals, which is the key word, sure, you can call someone like online, but like, what is the difference between calling someone online for a mental issue versus calling someone who you've known, a psychiatrist who you can can definitely count on and who knows your issue better than anyone else. There's a massive difference. That's the entire reason why telehealth is just so good. Now, let's go finally to the government arguments about governments not reimbursing. They've conceded a piece of evidence that takes down this entire argument, where we tell you the National Institute of Health literally announced $23 million in grants to establish telehealth centers, which means all their arguments on inaccessibility are probably wrong because they concede our own evidence, which is definitely a reason as to why they don't get access to this argument. So at the end of the day, accessibility happens under the aff world and the negative doesn't get anything. So you vote off.